Welcome back to ETV News and Sport. On to the latest news, of course. The South African Health Products Regulatory Authority is investigating metformin for possible cancer-causing chemicals. The drug is commonly used by people who have diabetes. Healthcare regulators in numerous countries have confirmed that they're investigating the drug for a substance called NDMA. The authorities apparently found 3 metformin products which contained the nitrosamine impurity in Singapore. Well, to tell us more about their investigation, we're joined by Flora Matlala, live from our Johannesburg studio. Of course, she is the head of pharmacovigilance at the South African Health Products Regulatory Authority. Flora, good afternoon to you. Thank you so much for joining us. Okay, let's clarify how serious of a problem we have on our hands here, because in South Africa, we know the high number of people we have living with diabetes that are using that medication. So if it does cause cancer, how big of a problem are we looking at here?
Okay, good afternoon, Naledi, and good afternoon to the viewers. Thank you very much for the opportunity that I've provided for SAHPRA to come and clarify the issue. So far, there hasn't really been a problem, except that we are cautioning the public about the possible contamination of the NDMA in the metformin medication. So we just wanted to highlight to the public that we are doing investigation based on the reports that have been issued by other regulatory authorities around the globe to ensure that our public is well informed while we are busy doing the investigations with the different manufacturers of metformin.
Okay, but at this point, then you're unable to confirm whether or not metformin that is distributed in South Africa does or does not have that chemical. That's what you're saying. We don't have those answers as yet.
Okay, as soon as we have done the investigation and we've got the results, we will be able to inform the public about the contamination of NDMA in metformin. At this point in time, we are unable to pinpoint any specific metformin-containing product to say it contains or it does not contain. But as soon as we've got the results, then we will be able to highlight to the public which products are actually affected and which ones are not, and which ones will be recalling if there's a need for a recall.
Yeah, but surely we do know, what we do know is if we buy from the same distributors as the distributors that were found in Singapore where this impurity was found. So are we buying from the same distributor?
Okay, we must just remember that each and every pharmaceutical company will be buying from a different supplier. So that is exactly what we're trying to establish as to whether of any of our applicants at this point in time, that is the manufacturers, are buying or using the same ones that have been recalled by the Singapore. So as soon as that information is verified, then a communication will be issued to inform the public about the outcome of that investigation.
At what point can we expect that information to come out more clearly? Because at this point you have millions of people that are living with diabetes using this medication and now afraid to take their medication.
As you may be aware, investigations are taking time, but we are ensuring that as soon as we have the relevant information that we can communicate something concrete to the public, then we'll make the public aware of this the investigation outcome. But at this point in time, the investigation is ongoing. The manufacturer are busy in doing the investigation. So as soon as we have something on hand, together with what we're doing to ensure that whatever that has been used by the Singapore, we also have it on hand. So by next week, we should be able to communicate something to update the public about the outcome of this investigation.
I think that the question that I'm trying to get to, or the answer that I'm trying to get to is, as someone living with diabetes, do I continue taking my meds right now, yes or no, or am I putting my life at risk?
Okay, because diabetes is a very dangerous condition, we advise the public and the patients to say continue taking your medication as it has been prescribed, and we also advising the healthcare professional to prescribe it as appropriate so that we can ensure that the blood glucose level are actually under control up until we can say something that is concrete to say which one you can stop and which one you can't. But at this point in time, we say continue taking your product because it might not be the affected one. So we say continue taking that.
Yeah, thanks for that, Flora Matlala, live from our Johannesburg studio. Of course, she right there representing pharmacovigilance at the South African Health Products Regulatory Authority. What do you make of that? You're living with diabetes. You need metformin to keep your glucose levels, solid, to keep yourself healthy, to keep your sugar levels low, correct? And now you're hearing that medication possibly could cause cancer. That's frightening. What do you make of that? A tweet at ETV News SA or send us WhatsApps 082 777 0733.